Good evening and welcome to the first career guidance session organized by the KMDC Alumni Association in collaboration with the Karachi Medical and Dental College. I'm your host, Samra, and our topic today is cardiothoracic surgery as a career. Our speaker is the esteemed Dr. Hina Inam. Dr. Hina graduated from KMDC in 2011. She received her training in cardiothoracic surgery from the Aga Khan University and Hospital and has worked there since 2013. Tonight, she will share her journey of becoming a CTS surgeon. Before we begin, I would like to inform our participants that the Zoom meeting will automatically disconnect at 6:30. When it does so, please click on the same link as before to rejoin the webinar. We also request you to please ask all questions in the Q&A part of the chat box. The speaker will answer all questions at the end of the session. Please remain muted. I would now like to welcome our speaker, Dr. Hina Inam.
Everyone. To speak and talk about cardiothoracic surgery. I'm sure I'll be able to guide you in some way as much as I can. So if I, Alize, next. Yeah. So if I start, I'd like to start off by my story. Why did I become a doctor? A few questions that people usually ask me when they come to me for career guidance. So if I start off, why did I become was the answer that is I have always wanted to be a doctor and wanted to be like them. You all know that I am a KMDC alumni and I'm very proud of being one. I've learned a lot from there. Once I was done with my MBBS, I joined Abasi. I did my 6 months of internship there. I did initial 4 months of medicine and then 2 months of nephrology. And I was really very happy. I'd planned that I will definitely be either a nephrologist or an oncologist, something in medicine. And I was really happy that one papers ho rahe hain for internship, why don't you apply? And I was like, no, I'm really happy with whatever I'm doing. And I'm really happy working in Abasi. But he was very persistent and I was like, okay, sure, I'll go, give the test and maybe hoga bhi nahi. Well, I went in, gave the test, and God knows, I passed. Then there was the OSCE. I went post-call from my nephrology ward, gave my OSCE, I cleared that. And then obviously अब pass हो ही गए थे तो अब जाना ही पड़ता क्योंकि my dad really wanted me to be there. When I started my internship at surgery and medicine, and then you were allowed to do subspecialties as well. So my initial 6 months was surgery, where I chose neurosurgery for the first 2 months, then general surgery, and then cardiothoracic surgery. In cardiothoracic surgery, while I was doing my internship there, it was that time when there was this trend that every intern would do a sternotomy at least once when they're rotating there. I remember it was my last day as an intern, and if I don't say it myself, I was a good as fast as possible. Was with the consultant who did the most cases, and we had a really rough time doing throughout the internship period. And I remember it was a Sunday, and my chief calls me up. This was Dr. Ali Mangi, who's now a cardiac surgeon in NICVD. He calls me up and he tells me that there's a case and this is your sternotomy. You should come into the war. That changed my life. So I went in, I scrubbed in, did the sternotomy, I did the pericardiotomy. And when I saw the meeting, it made me fell in love with Alamia. It made me feel that this is an organ that Alamia has made that keeps on beating throughout our life, and it stops only in two parts, only in two ways. One, when you die and Alamia makes it stop, and the other is when you're being operated by a cardiothoracic surgeon. Then was medicine, and at the end of my internship at Aga Khan, I knew that I love doing things with my hands and I would love to be a surgeon. And cardiothoracic surgery was it. I started my cardiothoracic residency at Aga Khan. It was a really all day long, not thinking about eating, operating day in and day out. I've had amazing mentors who have helped me in every way. I've been through a lot through my residency. I still remember. So like every kid, I wanted to be somebody whose parents look at her and they're proud of her. So it was just a week before my residency was, and I was my graduation. I lost many of my parents. I was standing there. I am the only and the first female cardiothoracic surgeon to have graduated from Aga Khan University Hospital, and it was a big moment for me. But sadly, I didn't have either my mom or my dad there. Since then, I worked as a instructor at Aga Khan, and then now I'm a consultant there working on, and it's been a journey. Next, so if I came across this very important paper which showed the reasons that why medical students choose specific specialties. So there were a lot of reasons that they came across. It included shorter length of stay, avoiding on calls, shorter work hours, prestigious advice from others, financial reasons, job opportunities, whether that career was helpful to the community, and personal interests. Um, if I was to advise you of what to choose for your career, so always remember, choose something that you love, because that is the only way that will take you to success. Because you don't want to be stuck in a profession where you don't love doing whatever you're doing. Because it's not just you're not choosing this for a day or two, but you're choosing this for a day or two, but you're choosing this for the rest of your life. Because it's you want to wake up and you want to do it with all the passion in the world. And when there's passion and love in whatever you're doing, success will run after you. So whatever you choose in life, make sure that it is out of your love for that work. It can be medicine, it can be radiology, it can be gynecology, it can be anything that you do. But make sure whatever you're doing or whatever career you're choosing, it is based on your love for that field. Next. So in these slides, I like to tell you about cardiothoracic surgery, what cardiothoracic surgery actually is, what does a CT surgeon do, what are the challenges that we face, and what is the future, what is in there in the future of cardiothoracic surgery. Next. So we talk about cardiothoracic surgery as a field. It includes cardiac surgery and thoracic surgery. Cardiac surgery itself, where we deal with cabbages, off-pump cabbages, mid-caps, aortic valves, mitral valves, double valves, redos. While if we talk about congenital cardiac surgery, we talk about cases like ASDs, VSDs, PDAs, switches, shunts. Then there's thoracic surgery, which involves surgeries being done by VATS, which is video-assisted thoracoscopies, or open sternotomies or thoracotomies. It can be decortications, it can be lobectomies, it can be mediastinoscopies. Next. So what does a cardiothoracic surgeon do? So if you become a cardiothoracic surgeon, you do not only operations when there is So these, whenever you talk about cardiothoracic surgeons, these surgeons not only operate, but we also deal with our patients in the ICU. So patients post-operatively, pre-operatively, you need to be very careful while you're assessing the patient for surgery. In the operating theater, you are not only a surgeon, but you need to be on your toes. You need to be an anesthetist. You need to be a good perfusionist. You need to be a surgeon. You need to be a good technician. Why? Because if anything happens, you need to know how to cater that. Next. So what are the traits of an ideal cardiothoracic resident? An ideal cardiothoracic resident has intelligence, drive, stamina, loves challenges, hard work, and positive outcomes. Is results oriented, loves making with their hands as well as their brain, and enjoys caring for others and interacting with highly competent physicians and other healthcare professionals. So if we talk about the training pathway, we have two broad categories. It can be either your training can be in Pakistan or it can be abroad. So if you choose the pathway that I took, that you stay in Pakistan, you do your internship or house job in whichever hospital. Once you're done with that, you do your part one. Once you're done with your part one, which would be in surgery, you apply for residency. If we talk about only Karachi, you have different centers like AQH, NICVD, Taba, DHS, Abasi, Patel, Civil, Jinnah, where you can apply for residency. There are two ways. There's a 2-year track and a 4-year track. 2-year you only apply for surgery to a hospital, and once you're done with your general surgery, then you apply for cardiothoracic surgery specialization in the hospitals which are doing cardiothoracic surgery, or you can start from the get-go. Like in AKU, we have both cardiac surgery as well as general surgery, and so I did all my 6 years in Aga Khan. And once you're done with that, you're a cardiac surgeon, and you can continue doing an instructorship or a fellowship, and then continue to work as a consultant, or you can go abroad for fellowship. Next. So in abroad, the major two categories that I've seen kids going into are either towards the US or the UK. So whatever you do, if you plan to go to the US, you have to give your steps. You have to sit for your match and do your residency there. If you want to go to UK, you can do PLAB or MRCS. Or if you want to go to any other country, Canada, Australia, whatever, you have to give their pertinent exams. When I started off, I wanted to go to the US as well. While I was working in Basi, I started studying for my steps. But then one day, while I was working, 7 o'clock, my sister calls me up and tells me that my dad has a heart rate of 28, and I was like, that's not possible, and if he's okay or not. And she told me that my dad was feeling a bit dizzy. I told her to take him to a nearby hospital. He had sinus bradycardia, and then told her to take her to a nearby cardiac hospital. He was taken to an ICVD there. They gave him atropine. He couldn't be reverted back, and then he had to be taken for a pacemaker placement. While he was there and while they took consent from me, because I do not have any other relatives here and I'm the eldest, I have never seen a pacemaker put in. I had never studied a pacemaker before that, but I could imagine anything and everything that could have gone wrong with my dad. And that was the moment that I decided that no, it's better that I stay here, do whatever I want to do here in Pakistan, and then we'll see. So I dropped my idea of doing steps, but my advice to all of you is that please, 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 even if you want to stay here in Pakistan, give all these exams. Make sure that you give your steps or your PLAB or your MRCS, even if you want to stay in Pakistan. Why? Because all of these will help you get a fellowship abroad. These fellowships aren't just for a year or two, and that's okay. That's the time that you can somehow leave maybe and just get that specialization and then come back. But make sure that you have this on your chart that you want to give your exams. Next. This is another question that a lot of people ask me, if CTS was a dying field. A very important answer to this, that it is a specialty in its adolescence, adapting to the evolution of modern medicine. So what is left in CTS? While there's minimally invasive cardiac surgery all over the world, people are doing minimally invasive cardiac surgery. They're doing TAVRs, which is trans-aortic valve replacements. There's very, very few congenital cardiac surgeons in Pakistan. There are about 12 throughout the country, which is very less. Then we have thoracic surgery. We have very few thoracic surgeons here in Pakistan. Then there's transplant surgery, which is not even existent in Pakistan. And then there's heart failure surgery. So if next time anyone tells you that CTS is a dying field, tell them that no, because yes, cardiologists have taken over cabbages. They are putting in stents, but there are a lot of cases left. And there are a lot of cabbages that they cannot put in stents in. There are a lot of cases where they dissect a vessel and they call us up. So no, CTS is not a dying field. Next. If you take, that's the major bulk of CTS, of how you get in and what you want to do. From all of this talk, or if one message that you take away from this is, these are the things that you should definitely do. You may be a year 1 MBBS student, you may be a year 2 MBBS student, you may be somebody who's doing internship or somebody who's doing residency. Make sure that you have a CV, even if you are a first year medical student. Why? Because whenever you're applying anywhere, nobody knows you. It's your CV that is the first audience or the first face that they see. So make sure that they have something to see. Start making it from now. Start putting it, things that you're doing every day. If you've been to a webinar, if you've been to a seminar, if you've done some research, just keep on adding it every day, slowly and gradually. Just add things and just forget about it. Just add things and forget about it. And at the end of the day, when there's time for you to apply somewhere, you'll have a CV in hand. You won't be troubled at the end. Okay, no, I'll have to make a CV right now, or what do I put in or what I don't put in. So it's very important that you have a CV. Number 2, please do research. You can start small. You can start with case reports and start building up on that. The third thing that you need to do is find a mentor. A mentor can be somebody who's a senior to you. It can be somebody who's a doctor or a surgeon that you look up to. That can give you an advice and mentor you in whatever passion you have. Thirdly, if you're not sure what you want to do or which field that you want to apply to, if it's cardiac surgery, if it's neurosurgery, make sure that you go work there, do electives, so that get to know a bit about it. So you get to know how they work and how will it affect your life if you were in that position. Another thing, read books, read literature, and that will help you. And the most important thing is, whatever you do, please enjoy. We are not in a rat race. We are given this life only once. Make sure that you make it worthy. Whatever passion that you have, whatever work that you want to do, whatever career that you want to choose, make sure that is something that is out of love, out of passion, so that this life is not a burden to you, and every day is something that you enjoy every day. If you have any questions, I'm up for it.
So Dr. Hina, some questions we'd like to ask you is, when you started out, and when you were applying for training, what did your CV look like?
So I've been blessed in that sense, because when I was starting out, I had really nice mentors. I had really nice seniors who actually gave me this advice, what I'm telling you today. I really didn't realize that what they were telling me at that time would have helped me, but it has helped me a lot. If I when I was starting out as intern, I had two researches in my CV. I had a lot of experience of electives, and I had a lot of extracurriculars um, that added up in my CV. From that day till today, my CV has bunked up, and it has a lot to do with my mentor, Dr. Solath. He's helped me build that up. He's the one who's been at my back, telling me to do researches, telling me to work hard, and telling me all these things that I at that time thought that yaar ye pata nahi kyun mere piche pade mein, but it's actually made me who I am today.
You're definitely very lucky to have had Dr. Solat as your mentor. His reputation precedes him, genuinely. Can we ask you how you approached him first?
I never approached him. I was his intern. I was his intern when I applied for internship, and I've known him since. So it was meant to be. And it's not just Dr. Solat. I've had amazing mentors throughout. I've in general surgery, I've had people like Dr. Rizwan Khan, Dr. Sadaf, Dr. Hasnain, Dr. Tavish. All of these surgeons are the surgeons that I have in my hospital. Um, Aside from that, in cardiac surgery, I've had Dr. Shahid Sami, Dr. Hasnath, Dr. Mahim, amazing female cardiac surgeon from US, Dr. Waris Ahmed, Dr. Shahab, Dr. Munir, Dr. Asif. All of these people have made me who I am today.
That's amazing. You've had a great career.
Yeah.
Do you remember what your first research experience was?
Yes, and it was horrible. So this was a case report that was given to me when I was an intern, and this was a kid who had a hemi-mustard procedure done. What happened with that case report was that I had sent it to an Indian journal, and they'd accepted it. But the bad thing was that apparently we can't send money to India. And it got stuck for another 4 years, and it got finally published in my fourth year of residency. Till then, I had already published a lot, but that was the first ever thing that I had written and had gotten submitted and acceptance.
That is terrible. That's genuinely worrying to hear about. I think what really worries students today is how to start research work. We're all very unsure.
Yeah.
Do you have any advice for that?
Yeah. So, one, that you need somebody, research easy, right? One of my mentors, Dr. Adil Heather, who's the dean, he's told me that you can do research on anything, even on the laptops that everybody's using right now, or the phone that they're using. So you can do research on anything and anything. One. Number two that you need to understand is um, it's not the research. Research does not only entail that you take up a topic, work at it, and that's just it. No, a very major part of it is how or where you're sending it, and then just have a lot of bardast, because you can get a lot of rejections. You can get a lot of no's before your paper is finally published. It can take good 2-3 years for one paper to get published. So it needs a lot of bardast. It needs good mentorship. It needs somebody. If you do not know how to do research, it's best that you learn now, because research is it.
Okay, that's good to know.
Uh-huh.
I'm going to read out some questions that
Sure.
our participants have asked. So,
Uh-huh.
one question is, what's the difference between the 2-year and 4-year program?
So there's no difference. Whenever you're applying, you have as per CPSP. So there's CPSP, which is College of Physicians and Surgeons, which is the main authority that takes the final exam, which is the FCPS Part 2, and you have to enroll in the residency program. As per them, you have to tell from day one which subspecialty you want to join in. Right? So if you've decided for cardiothoracic surgery, so for cardiothoracic surgery, the total years that you have are 6 years, 2 years of general surgery and 4 years of cardiothoracic surgery. It is the same for orthopedics. It is the same for plastics, peds. It is the same for orthopedics. It is the same for neurosurgery. All the subspecialties. It is 2 and 4 years for my hospital. For the rest, it is 2 years and 3 years. So there are hospitals which have only general surgery and do not have any subspecialties there. So if you are not getting enrollment in a hospital which does not have cardiac surgery, and you've already enrolled as a cardiac surgery resident in FCPS, in CPSP, what you can do is you can join a hospital for 2 years, and then once you're done with your 2 years of general surgery, you can apply at places where cardiac surgery is already done for the next 4 years.
And this is only for Pakistan?
Yes, that's for Pakistan.
Okay. Another question is, what are your comments on the infamous notion that for Pakistani students or any IMG, it is near to impossible to match into surgery, considering students who want to go learn robotics and surgery and other new stuff that isn't in Pakistan yet?
I do not believe this. I do not believe this because I know a lot of general surgeons, I know a lot of thoracic surgeons, and I know a lot of IMGs who are cardiac surgeons who are working in US or UK and doing amazing things. So I do not believe that.
That's very reassuring to hear. Okay, another question we have is, what would you advise a third-year MBBS student aspiring to be a CTS surgeon? What made you stand up among thousands of individuals trying to get into AKU?
So for the first question, third-year MBBS student, all the 5 things or 6 things that I told you, make sure that you have a CV, make sure you start working from right now, doing researches, make sure that you get a mentor for yourself, make sure that you have either done electives or you know what you're getting yourself into. And that's about it. Read. For the second question, what made me stand out? I'm not sure. So it's a very rigorous system when it comes to joining an internship in AKU. You have to apply and then you have to give a test. Once you've cleared the test, then you have to do an OSCE. Once you clear the OSCE, then you have these choices where you can pick whatever, whether it's CTS, neurosurgery, whatever you want to do, as per the choices that are left for you. So
okay. Someone asked, if someone wants to pursue the PLAB pathway in the UK, is it easy to get residency in CT surgery there?
So yes, it is. A student of mine, Mariam, is actually right now doing general surgery there, and she's due to apply in CTS there. So for people who say that it's difficult and just by thinking that it's difficult, they won't apply anywhere, I think you're giving up too early. So if you're passionate about this, just go for it. And Upar Lamya baitha hai, and he's seeing that you really want this, he will give it to you, no matter how difficult this is.
Absolutely, for sure. Inshallah, Allah better karega. How do you find your work-life balance to be?
So if you're a resident, there is no work-life balance. For me, I've had almost zero work-life balance, but I've had really supporting parents and very, very supporting family and friends who've always been there for me because we have very long hours of surgery. But I think it's the same for neurosurgery, orthopedics, and whatever subspecialty that I'm talking about as far as surgery is concerned. But once you are done with your residency program, you can pick and choose your cases, and then you can have a considerably well work-life balance.
But not before your training is complete.
Training is the same for everyone. If you talk to a medicine resident as well, they will be as um, uh, you know tired and as zero in their work-life balance as a surgical resident. So training is the same for all. Everybody's working as hard as possible.
Okay, that's interesting to hear because you always hear about surgery being a much more difficult and demanding field than medicine fields.
No, because so my best friend is an internist in US Boston right now. She's gone through as much torture as I have and as much zero work-life balance as I have. So, and I have a lot of friends who are working in medicine here as well, and they worked their asses off as much as I did.
That's very reassuring. So, as a trainee, what did your day or your week look like?
Their week look like? So as a trainee, your days change. If when you're a junior resident, you are mostly in the wards, looking after not only the patients who are on board, but also taking care of all the consults. Consults can be emergency consults where you have to put in chest tubes, or rush the patient to the OR, making sure everything is spick and span, look after interns, making sure everything's clear, and get doing rounds. Once you go to a senior level, you're a chief, your day is spent after you've done with rounds. Your day is spent in the OR all day long. You're operating 24/7, and whatever cases you get your hands on.
And has your schedule changed very much after your training ended and now that you're a consultant?
So once you're a consultant, you actually miss work because now you're a consultant, you have a lot of people doing a lot of work for you. The things that you used to do, you have people doing that for you. And all you have to do is just go and operate and enjoy your life.
That sounds so much better though compared to residency, where you hear these really long hours and you're on call and it's very stressful. So
No.
when you
So
were
as a
under
consultant, you're
that,
on call as well as a resident.
yeah.
You're on call only once every 4 week, every 4 day. As a consultant, you're on call for the whole week in a month.
Oh.
So you are on call, you are operating like crazy as well sometimes. But yes, you do get a lot of time on your own as well.
So how do you manage to deal with all that stress?
I actually enjoy all of my work. I love what I do. I love operating. I love seeing my patients, and so I don't take it as a stress actually.
So do you think you have to be a type A personality type in order to enjoy this lifestyle, or is it for everyone?
No, no. Just Dr. Azmi is a general surgeon. He once told me that nobody is born a surgeon. You learn, and then you work at it, and you become what you want to become. So there's no A type or B type when it comes to doing surgery. If you're passionate about it, anybody in the world can do it.
So when you were a student,
Uh-huh.
did you go for these type of electives as well, for surgery based, or did you just do any electives?
So I did my electives in a lot of electives in emergency medicine. And I loved it. There was a time where I really, really wanted to do, trauma and trauma bay or the resus step down areas. And I would just stay there and do all the resus ka kaam. And it used to give me adrenaline rush to see all those patients and, make them well. So I've done a lot of electives in ER. I did an elective in cardiology, not in surgery though.
Can you share where you did these electives?
I did these in Aga Khan. I did one in NICVD.
And they definitely helped your clinical experience, I'm sure.
They help me with my clinical experience, but I'm a cardiac surgeon now. I've never worked at cardiac surgery before. So experiences, it sure gave me a lot of experience.
Okay, that's good to know. And did your electives help you when you were applying for an internship?
So as I said before, the application process depends upon how well you do in the test. And once you've cleared the test, you have to do equally well in the OSCE, and then that's how it is. I'm not sure it has anything to do with my electives or my work experience. It was a process of being evaluated by exams.
All right, Dr. Hina, one last question before we end. This is a bit of a personal question, I think, that I think all the girls participants right now would like to ask. Do you think, as a woman, it was harder for you?
Yes, I am the first cardiac surgeon to have graduated from Aga Khan, and I'll tell you a few experiences I've had. I remember this one day, I was really, it was the start of my residency, and we just de-scrub at 1 o'clock at night. And I had two other residents who were at the same level as I am, working in the same case. And when we de-scrub, the consultant very casually asks me if I was okay, and why am I doing this to myself, and if I really wanted to do this, and because it's so late at night. And I was like, sir, nobody can make me do anything that I do not want to do. Number one. Number two, I've had two other residents who were working with me at the same level that I'm working. Why aren't you even asking them? Maybe they don't want to do it. Why? Just because I'm a female. Another instance, I was told by somebody that apparently females can't be cardiac surgeons. And for all those females who want to be cardiac surgeons, I have been trained by a female cardiac surgeon, Dr. Mahim. She's from the US, and she's one of the most amazing people that I've known, and really helpful. And the cardiac surgery program in Aga Khan, that actually was developed by a female herself. Yes, as a female, you might have to work harder. You might have to prove yourself more, but there's no work that you can't do.
I'm so glad we have people like you to look up to in this field. It's
Thank you.
really a source of comfort. Thank you so much for all your work, and thank you for this webinar. It was very, very helpful.
So if there are any questions left that I wasn't able to answer, make sure that you email them to me and I will answer them personally. Secondly, if anybody wants to reach out, talk to me regarding research, regarding career counseling, I will be equally helpful to help.
We will be sure to share your email with everyone. Thank you so much for everything. And thank you to all
so
the
much for having
participants for
me.
attending. Right. Thank you, Dr. Hina.
Thank you.
With this, we'll be ending the session. And you can reach out to Dr. Hina later if you need to. Allah Hafiz.
Hafiz.